Hi everybody, my name is Sean Doherty and I'm a R2 at the CLC Côte d'Ivoire, but I've been gone for the past 5 months doing the rural stream at Shawville, something that I highly recommend. And I'm here today to talk to you about chart audits as an option for a research project. And I'm recording a video because I can't be there today, but even though it's embarrassing to record a video, I thought it was important for your benefit so you don't waste as much time as I did trying to choose a research project. So hopefully it results in saving some of you a bit of time and grief. So for my research project, I knew I wanted to do something about HPV vaccination. And basically because I had seen a patient who had LSIL on their Pap test, and I mentioned the HPV vaccination, and they said they had been told by a previous physician that they were ineligible. So that made me worry that maybe the CLSC, we were not doing a very good job at keeping up to date on the guidelines. So I knew I wanted to do something about that, but I thought I might do a survey, which would involve writing a survey with questions for physicians to test their knowledge of the guidelines, validating the survey, sending it out to physicians anonymously, waiting for them to reply, then compiling the results. So the whole thing seemed a little bit overwhelming for me as someone who's not really into research. And in the end, I was kind of running out of time, so I did what many other people would do. I procrastinated, worried about it endlessly, and did a bit of reading on the topic to maybe do a literature review. So in April, I went to Dr. Eunice's office and I said, you've got to help me. I don't know what I'm going to do for this. And she said, well, Sean, after I explained to her what I wanted to do, she said, well, you should do a chart audit. And as soon as she said that, that made a lot of sense to me. But it was something that I guess I didn't realize I could do, maybe because no one had mentioned it specifically before that. So basically, also because she's Dr. Eunice and she likes a little bit of controversy and to keep things fun, she said, now, don't only look at how well it's documented in the charts, but also look at how well it's documented by the sex of the provider that's seeing them. And then I decided to also add in staff versus residents versus medical students, assuming that medical students would be the most over-inclusive in their charting. But in the end, I did a 2-year retrospective chart audit. I looked at about 100 charts from female patients seen at the CLSC aged 9 to 26. And I chose charts that were age 11 to 26 at the end of 2 years because I wanted them to be 9 to 24 at the start, so that therefore they would have been, for the whole duration of the study, eligible. So to do my chart audit, I used a really good document called, a really good article called 8 Steps to a Chart Audit for Quality Review. And that was on the Association of American Family Physicians website. And basically the 8 steps I'll go through right now are choose a topic, so I already explained how I did that. Now the next step, identify measures. This is crucial for your chart audit. It's one thing to say, I want to look at how well it's documented. It's another thing to actually go through the charts and decide what counts as documentation. So you really need to decide before you start what counts, what doesn't count, what you're going to record as a positive result or a negative result, or if you're going to do more than just binary. These are all important things to think about. So for me, initially, I was just going to do every time it was recommended. And then I realized, well, that doesn't really cover all of it. So in the end, I did any time it was recommended, discouraged, charted that they never got it, charted that they had already received it, or it was charted that the patient asked about it. And then, of course, the opposite would be nothing was charted, and that was a negative. You also need to think about what if you're going to do electronic charts at the CLSC, what type of charts you're going to look at. I initially thought I was just going to do progress notes, but then I realized I would be missing out on all the annual exams done on examen annuel sheets, so I included those. Then I included user profiles and medication lists just to be complete. But whatever you do, you're going to have to think about those aspects, because the minute you start, you're probably going to see some new things, decide that you want to change it, and then you're going to go back and have to start from the very beginning so that you've been consistent with every single chart you've seen. The next step is population. So I've already talked about that a bit. But the other thing to think about is what's your inclusion and what's your exclusion criteria. So for me, inclusion criteria was based on age, sex, and then having seen a physician at the CLSC at least once outside of SAM Rendezvous. Because I considered SAM Rendezvous not necessarily the time where it's appropriate to bring up all kinds of preventative screening things. But ideally you would anyways. But for me, that was my inclusion criteria. And then determining sample size is the next thing. So you have your population group, now you need to decide how many charts you want to audit, and the more charts you audit, the narrower your results confidence interval will be. So the more valid your results are. So something to think about. And the article on the AFP website goes into that a lot, so I won't talk any more about that. Then you need to create an audit tool. So I came up with a spreadsheet that basically recorded the information I needed to get from each chart, so I didn't have to go back, and then helped me easily calculate everything into one big sheet as well. And then you need to collect your data, summarize it, analyze it, and then of course come up with discussion. And the part they didn't mention is you really need to do research. So you need to do the research to understand why, for example, HPV vaccines are relevant. What is the proof that they're good, or that they should be done? What is the Quebec government saying that we should be doing? Those are all relevant background information you need to support in your research project. So just logistically, things that I thought were important that really need to be stressed are the measures. Again, I can't state this enough. Basically, you need to come up with rules of how you're going to do your chart audit, and we'll come up with them, and then you should do a mini audit. So you should do a mini audit of 10 charts, because the minute you start looking at charts, you're going to start realizing, oh, I never thought about this, or maybe I don't want to include these ones, or maybe there's this other type of document that would be really handy to include. So it's worthwhile just to do 10 charts, not even to be counted in your audit, but just to help you guide your audit. And then after you do that pilot audit, then you can start on your real sample and apply those changes you've made. And that will, I think, save you a lot of time, and will help direct what you want to do exactly in your chart audit. The other thing is, once you have your population selected, you can call archives, tell them the population you want, and they will print out an entire list of them, from which then you can choose your sample size. And so basically, why do you want to do a chart audit? Well, I think it is a very rewarding and relevant way to do a research project. So, anything you do with the CLSC, it's going to be relevant to all of us here, and you're going to be presenting to our staff, the other residents, and it's going to be about how good a job they're doing. So it's immediately more relevant, and I think it does create a change. Just by the sheer fact of mentioning something, for example, HPV vaccination, a lot of people might say, oh yeah, I never document that, so maybe I'm going to start doing that now. So I think it at least creates an awareness, and that is worthwhile in doing just for itself. The other thing is that you don't have to be entirely original. You can actually take a chart audit done somewhere else and do it at the CLSC, although I'd suggest trying to be original. But if it's the first time it's being done at the CLSC, then it is helping the CLSC, and it's good for quality assurance. The other thing is, I think as an R1, it's a really great experience to go through charts, read about them. For me, I looked at a 2-year period for each of these patients of all of the visits they had with physicians at the CLSC, and I saw all the problems they came with, I saw all the treatments, and I also saw how everything was documented. And I think documentation is a great way to learn about how you yourself want to document. So for me, I realized maybe I was a bit over-inclusive. I saw a lot of other people used shorter types of documentation. So it's just a good idea to see what's out there in terms of how other people document, and then apply that to what you're doing yourself. And lastly, I think it's fun, interesting, and it's a pretty straightforward, not too complex, but you can really make a difference with it. So I think it's a great possible way to do a research project. Okay, thanks.